I'm Jennifer Jones.
And I'm Taylor Stevens.
And we have carpal tunnel syndrome.
Our patient's name is Vivian Thompson, who's a 50-year-old female. She's been an administrative assistant for 30 years. On her spare time, she gardens, cooks, and plays cards, but has a tendency to drop things during these specific activities. She's had chronic pain for the last 8 years. During pain, she usually takes 2 Tylenol, which gives partial relief. Her numbness and tingling starts usually in the first digit, but then over time goes to the second and third. During resting activities, just like laying on the couch watching TV, she has no pain, and during activities, her pain is an 8 out of a 10. We did Goni measurements on her wrist. We did right and left. Her flexion was 53 degrees with pain. Her extension was 79 degrees with pain. Radial deviation was 18, and her ulnar deviation was 43. Then with her uninvolved limb, her flexion was 88 degrees, extension was 85, radial deviation was 20, and ulnar deviation was 45. Then we performed manual muscle testing on her right wrist. The extension was 3 out of 5 with no pain. Her flexion was 2 out of 5 with pain. Radial deviation and ulnar deviation were both 4 out of 5 with no pain. We did the uninvolved limb, which is the left wrist. The extension was 5 out of 5 with no pain. Flexion was 5 out of 5 with no pain. And radial and ulnar deviation were both 5 out of 5 with no pain as well.
Okay, so some major concerns that we have with carpal tunnel syndrome is the nerve damage that could happen with the median nerve. You see that it runs right along here. Whenever you have nerve damage, it can sometimes correspond with some muscle atrophy, and that's what we also want to make sure doesn't happen. And then since she's a woman, we actually have smaller carpal tunnel areas, so we have to be a little bit more aware of that if we choose to go the surgical route. Also, another thing that we want to make sure that we absolutely do is relieve her numbness and tingling, and that we get her back to doing her basic ADLs like driving, eating, brushing her hair, things like that. So with the non-operative, we have a shorter rehab, less expensive obviously, and less invasive. This includes bracing, injections like corticosteroids. We have different kinds of therapies, modalities. You can even do acupuncture, that's a pretty popular one. Laser treatment, yoga actually happens to be coming up, and some other exercises too. There's less of a chance of a neurological or functional deficits because you're not tampering with that area surgically, messing around with whatever the nerve is surrounding. But with operative, so we have a longer rehab, and it's going to be immobilized for a period of time, normally like a couple days depending on the doctor and the patient. It's pretty invasive. What they're going in and doing is cutting the transverse carpal ligament, and as soon as you do that, it releases the pressure off the median nerve. So we can go back. So they're going to cut this, and it releases this pressure, which gives the patient instant relief of pain, so they automatically feel like they're better.
Since we chose non-operative, these are the goals. For the short term, for the first week, we did decrease active pain of the right wrist to 5 out of 10, increase manual muscle test of the right wrist to 2 out of 5 with no pain, and increase the right wrist extension to 85 degrees. For the next 2 weeks, we did increase right wrist flexion to 68 degrees and decrease active pain of right wrist to 3 out of 10. For the long-term goals, we did type continuously for 10 minutes with no pain, brushing your hair and putting it into a ponytail with no pain, or dropping your brush or anything like that, cooking a meal with no pain, plant a bed of flowers with no pain, and drive to work with no pain.
Okay, so we went along with our exercises with the phases that we're going to do. So in phase 1, we really don't want to do a lot. We're going to make sure that she's immobilized, and we just decrease her pain. So we're going to start with the warm-up of paraffin. That's what a lot of our patients like to do when they have carpal tunnel syndrome. It's just for 10 minutes. And then we're going to start her on some stress ball squeezes. We're just going to hold a stress ball and then squeeze it a couple times for like 30 seconds, 3 times. We're going to do some wall presses, making sure that we stretch out the flexor side of our wrist. So we're just going to press into the wall, hold it for a couple seconds, and release. Do this a couple times. We'll do some ABCs with just our wrist, making sure that she completes her range of motion using it all through. One that we made up was fishtails with the hands. So we're just going to hold it like this and make it like a little fishtail, making sure she works through the range of motion of flexion and extension. And then we're also going to do wrist extensions in the sand. So submerge your hands in the sand, slightly lift up, and then lower. The sand adds a little bit of resistance, but it also adds some tactile and proprioception because she's looking at her hand, raising them up out of the sand, then putting them back in. The sand just feels good. So at home, we're going to have her wear this kind of brace all the time. Just make sure it's immobilized, and then we're also going to have her doing some of the wall presses too, just stretching out that area, making sure that those wrist flexors aren't super tight. Next, with the phase 2, we're going to start with some more range of motion, working on that flexibility and strength. We're still going to do our warm-up with the paraffin, and then we're going to move to playing with some putty, so adding some more resistance and strength. We're going to put some little beads in there, add some tactile and proprioception, and pick them out so that we work on our fine motor skills as well. And then we're going to do some towel pinches, so you just lay a towel down on the ground or the table, and just pinch them up like so. And then we have TheraBand around the world, so take an actual TheraBand, whatever strength, on the low strength probably, and then she'll just do in each direction, flexion, extension, ulnar, and radial deviation. And then we'll do ABCs again, but we're going to add a 2-pound weight, add some resistance to it. Then we're going to do some fishtails like we did, but we're going to add weight to it, so she can either hold a dumbbell or we can submerge her into water, add some resistance either way. And then we also added a new one, the Gripmaster Pro Hand Finger Trainer. So this little guy, and she's just going to act like she's playing the flute or something like that. And it's going to work on her fine motor skills and her little flexors. At home, she's still going to wear her brace all the time. Then we're going to add some ball squeezes and the wall presses, add some strength, and still her flexibility in there. Then we're going to move to phase 3, more of our plyos, still warming up with our paraffin. We're going to add some wall push-ups now, so just regular old push-ups, but on the wall. Get some more strength in our upper body. Then we're going to add some chest passes with a weighted ball. Get some proprioception in there and making sure that she follows through with that flexion of the wrist. Along with the flexion of the wrist, we're going to shoot a basketball or any kind of ball, but making sure she follows through all the way, working on that range of motion. Then we're going to add some flexion extension with a dumbbell, so just like this, but we're going to have a dumbbell on there, probably like 5 pounds, really add some strength in there. Then we're going to do our ABCs again, but now we're going to write them in the sand with a stick. So she's going to have to hold a stick. It's a smaller grip, which she has a problem with sometimes, and she's going to have resistance, only using her wrist, writing her ABCs in the sand. Then we're going to end with some alternating flexion extensions on a TheraBand flex bar like this guy, but instead of bending it, she's going to twist it like this, really working on, again, her flexion extension. At home, we're only going to wear the brace for activities only, kind of weaning her off, and then we're just going to do TheraBand around the world, making sure she hits every direction in her range of motion. Lastly, we hit phase 4. We're going to work towards more the functional side of things, still warming up with the paraffin. Now we're going to shovel some dirt from one pile to the next. Just really working on the whole upper body, but also getting the supination and pronation of the wrist that she has to use as well. We're going to have her brush her hair, super simple, but she does it every day, probably 3 times a day, so it's definitely necessary. Then we're going to have her screw and unscrew some screws with a screwdriver. She's having to hold a very small object, use her fine motor skills, work on some proprioception and supination and pronation as well. Then we're going to have her copy some paragraphs down on a piece of paper, small object, making sure that she can do that because she obviously has to do it a lot with work and just activities throughout the day. Then lastly, fun and yummy, we're going to have her stir some brownie batter. Adds resistance, it's a small object, and everyone just likes brownies, so it's a treat. Then at home, we're going to wear a brace only during activities too, but we want to make sure that she's doing it when it's absolutely necessary. Just simple things, probably not wear them as much. We're still going to have her do some TheraBand around the world and some towel pinches now, making sure that we're still working on our fine motor skills. And that's all. And here are our sources. Thank you.